Good morning, Dr. Condon.
Good morning, Matt.
Very nice to see you. Thanks so much for coming in.
Nice to be here.
We're talking about dental issues in our pets, and just how common is it? How prevalent is dental disease in pets?
Dental disease is actually very common. The statistics that's generally thrown around is that 80% of dogs and cats over 2 years of age have some form of dental disease. That's something that plays out in day-to-day practice. It's actually quite uncommon to go through a day in practice without diagnosing some form of dental disease in dogs and cats. Gingivitis would be the most common and most visually obvious to us, and that's just the inflammation of the gum tissue in the mouth, the red inflamed gums. Periodontal disease is also very common. It's essentially an extension from gingivitis. If that's left untreated, then it goes on to create a breakdown of the support structure around the teeth, which is essentially periodontal disease. Broken and chipped teeth also are very common. Oftentimes, those are a result of injury or trauma at home, but surprisingly more often than not, they're as a result of what we actually give our pets to chew on.
Chew toys, yeah.
Well, sure, and some things like bones or deer antlers or hooves, which are very highly marketed as dental chews, they're actually much too hard for our pets to be chewing on. I've had the opportunity to travel to wildlife sanctuaries in the U.S. where we do dental work on tigers and lions and cheetahs and those sorts of animals. By far the most common problem that we see in them is broken teeth. So while it may be natural for wild animals to chew on those kinds of things, they most definitely also break teeth on them.
So for pet owners listening, how do they determine whether there is a problem, whether they have to take that next step and go see someone like you?
Well, there'll be some indications that our pets will give us. So certainly if you detect a bad odor from your pet's mouth, so bad breath is often a pretty good indicator of dental problems. Sometimes your pet will chew very slowly or very gingerly, or sometimes drop food particles from their mouth, so that can be an indication of oral pain. Excessive drooling, sometimes they'll just paw at their mouth or rub at their face, and that can be an indication of problems. Oftentimes those indications are really indicators of advanced dental disease. By nature, animals tend to want to hide pain, specifically oral pain, so by the time they show as outwardly signs, things can be quite well advanced. Much more importantly is for pet owners is just to develop a habit just from puppyhood or kittenhood to just routinely lift up your pet's lip, have a look in there.
Right.
If you see that brown accumulation of tartar or if you see any indication of red gums, go see your veterinarian and have the problem addressed in the early stages.
I know my dog is never too thrilled when I get the little toothbrush out and we have that moment together, but that is something that's important to do. What are some things people can do in terms of prevention at home? Yeah,
definitely just brushing is by far the best thing you can do. Unfortunately, the reality is it's not always possible to do that. A lot of animals just won't let us get in there and brush. There's other things that we can do, though. There's a lot of dental diets on the market that are quite effective at helping deter plaque and tartar accumulation. There's a lot of dental treats, and as you mentioned earlier, some dental chews on the market.
And some to avoid, as you were saying, too, yeah.
Well, avoid the hard ones, and the other thing you got to keep in mind with when you introduce a new dental chew is just do it under supervision for the first few times, because some dogs can be very aggressive chewers, and if they consume some of these products in a very short period of time, not only are they not doing what they're supposed to do as far as tartar and plaque accumulation in the mouth, but some of those products aren't very digestible and you can create some GI upset, some intestinal upset. One other thing I want to point out is there's a lot of stuff on the market, and there's a lot of claims for a lot of stuff on the market too as far as dental foods and dental treats and dental chews. One very important way that instrument the pet owners can use to help choose a treat or a food is to look for a VOHC stamp on the packaging. That's a stamp from the Veterinary Oral Health Council. They'll award these companies their stamp of approval.
And when we think of a typical visit to the dentist, we think of the little bib and the bright light and the spit cup, the flavored fluoride cleaning. What's involved in a typical dental visit for your pet?
In some ways, a lot of very similar things to our visit, but in a lot of ways, a lot of very different things as well. So when your pet's diagnosed with a dental problem, usually your pet will be admitted. General anesthesia is always involved in any dental procedure. So when your pet is sleeping, we can use various instruments to do a more detailed and thorough exam inside the mouth. And we'll also do dental x-rays to help give us a picture of what's going on underneath the gum lines. If everything is okay, no problems are detected, then we'll go ahead and do a cleaning, so a descaling. If, on the other hand, we find problems, usually we'll fix that. We'll deal with that in the same visit. Our goal is to prevent an environment in the mouth that's free of infection and free of pain so that the animal can go on and be comfortable for months and years afterwards. Pets are silent sufferers. It's nature's instinct to hide pain and discomfort. So if we kind of ignore the bad breath or we ignore maybe the little excess of drooling, we can't deny that dental problems or periodontal disease is painful.
You've given us some great tips and recommended the brushing of the teeth, but one thing I wanted to ask is how often? How many times should you do that?
Plaque accumulation occurs very quickly after brushing your teeth or very quickly after having your teeth cleaned. Once that plaque is on the teeth for, say, 48 hours, it's calcified into tartar. So in order for brushing to be effective, you have to do it at least every day in order for it to be effective.
I hope my dog isn't listening because
well,
we're going to have some time together tonight.
You and many others, yeah.
Dr. Condon, a pleasure to meet you. Thanks for all the good advice this morning. Appreciate it.
Thank you for having me.